the fact is that we speak as though people are not being successful in losing weight, but every day I see really good success stories, and I see people that have lost 50 or 60 pounds through diet and exercise or more, and we've seen them on TV, you know, and shows and everything, but I mean in real life. I can't necessarily predict who it's going to be when I see them in a clinic and recommend that they eat less, exercise more, lose weight, and somebody comes back having lost 25 pounds. You know, I don't even know how to anticipate who it is that's going to be that successful, but you know, the bottom line is that some people do it, and they do it very well.
Yeah. I also think I hate to see us get to a place where we villainize government, because I think if you look at some places, for example, in our county, our school district is a local government, and that school district, through a lot of community support and a lot of gnashing of teeth for a while, finally went to total scratch cooking in a large school district that serves 17,000 children. That is government doing something positive to motivate the children, their parents, the staff, and to set a tone in our community that says we can do this. And I also see places where local government is helping to incent more local produce coming to market. We only have about 2% of our produce coming from local suppliers. Well, I think there's ways we've learned how to incent large commodity production. So I think we can incent local production and say if we can have more local food, get it there, it is frequently healthier food for us to eat. So I'm hopeful that we can also celebrate those kinds of successes where our local governments have acted with the community in a way that has set a tone that's positive and shows that it can be done.
And I'm seeing, interestingly enough, I believe I'm seeing the most innovation in the public setting as well. I spent a lot of time recently in community health clinics in advance of the Affordable Care Act ruling, and they are bringing in dietitians and nutritionists to work one-on-one with patients. They're just saying, this is the biggest problem we're seeing in well-child checkups. It's obesity. You know, there really isn't another issue that is so overwhelming, and therefore we have to make this the primary focus. And they keep bringing the kids in over and over and dealing with it.
Well, when I see people on their breaks now in the work world, whether that's the public sector or the private sector, and people are out and they're putting on their sneakers and they're walking up and down. They may only have 15 minutes to do it, but you see them all over. Where I come and go to my office, there are lots of people that you can tell it's break time because they're out and walking, and there's a little walking trail that's been highlighted in the area so that people know to go over there. And it's setting this new sort of sense of health. We're going to go outside and we're going to walk a little bit. Well, when that adult does that and then brings that home, and the work's endorsing it, and then the parent has it, and then the child sees it, it begins to change. Now, it may be anecdotal, it may be too small to get to the big issue.
No, but it sounds like culture change.
It's a good point. We used to give people smoke breaks. We used to say you get 2 smoke breaks a day. So we're pushing employers to say if you believe that healthier employees are more productive, there's lots of data to suggest that, then it's up to you to give them 2 15-minute walking breaks. You can work at your computer or you can go walk, up to you, but you get paid by walking. If you believe that's good, back it up by making it policy.
So I want to show you a little something.
Oh yeah? I know those things.
I've been covering health so much and learning about the dangers of being sedentary that I decided I better look at myself. And courtesy of your folks, I got a pedometer. And it's remarkable how when I started to wear it all the time, when we all examine how many steps we're taking, you know, how you change your life. So I think this might be the key to success. How much do these cost?
They cost $15.
There you go.
Pretty good one.
And does that one work well?
It's great.
I was trying one last week and it just kept...
No, you got to pay at least $15 to get a good one, because people hate it if it doesn't work. If everybody had a pedometer, it would be a game changer.
And it's very positive because you think,
it costs
hey,
$15.
I just got this many steps by running up the stairs to the bathroom instead of taking the elevator.
Simple tool that provides feedback and motivates you to do more.